Hello everyone, this is Dr. PriyanakaAgarwal here. Welcome to our channel Talking Tooth. So we are doing chapter 1 of Pharma, that is Introduction and Routes of Drug Administration. So whenever we study any chapter, some questions come to our mind like what the chapter is about, what are the important questions from this chapter, and how should we read this chapter so that it is conceptual, exam oriented and easy at the same point of time. So coming to this chapter, it has two segments. It has introduction and routes of drug administration. So in introduction, we have some really basic things about pharma like definitions and divisions of pharma, sources of drug, drug nomenclature and dosage forms of drug. So whatever is highlighted in yellow here are the previously asked questions. So from this segment, sources of drug is previously asked question. Now coming to routes of drug administration, we have two parts here, local route and systemic route. So in local route we have these three routes, in systemic route we have all these routes. So routes of drug administration itself is a essay question. You can see that here. What I have done is I have just listed down all the important questions referring to previous year question papers. So you can see the second question here, enumerate various routes of drug administration. It's an essay question. So you need to write like little about each route, okay? So you need to study all the routes. Now, specifically local route, oral route, sublingual, transdermal delivery systems and intravenous are separate 4 mark or 2 mark question, okay? Now, coming to how we are going to cover it. So we have covered it in 4 parts. Like in part 1 we have done introduction. In part 2 we have done local route and systemic route introduction with local route in detail. In part 3 we have done the 6 routes of systemic routes, and in this video, that is part 4, we are going to cover parenteral route. Okay. So if you want to refer to part 1, 2 or 3, you can click on the I button and you can also check the description for the links. Now coming to the parenteral route. So what do you mean by parenteral? So conventionally parenteral route referred to by injection drug is administered directly into the tissue fluid or blood without having to cross enteral mucosa. Now what do you mean by this? So look at this diagram. So when you give any drug by oral, sublingual or rectal route, the drug reaches the GIT and it has to cross enteral, that is intestinal mucosa or GIT mucosa to enter into the blood. But when you give it by parenteral route like IV or intramuscular, you inject the drug directly into the blood or into the tissue fluid so the drug is absorbed into the blood without having to cross any intestinal mucosa. So okay, so it is parenteral. Okay, so this is the meaning of being parenteral. Now what are the advantages? Because intestines and the GIT are not involved here, it do not induce vomiting, and that's why it can be used in vomiting in unconscious patients. As drug is not going into the GIT, it is not reaching the liver, so it first pass metabolism in liver, and it has very fast drug action, so it is used in emergencies. Coming to limitations, so it is invasive. Invasive means we are entering into the tissues, okay? So that's why it is more risky. There are chances of local tissue injury. Medicament need to be sterilized, okay? And this is painful and there is a need of assistance for administration of the drug. So all this make it costly, okay? So these are the advantages and limitations of parenteral route. Now, if you actually notice, the advantages and limitations are exactly opposite of oral route. So you can observe that here, the advantages here are limitations there, and the limitations here are the advantages of parenteral route. Okay, so you can note that here. Now, coming to various parenteral routes. So we have some important parenteral routes like intravenous route, intramuscular route, subcutaneous injection and intradermal route. So we are going to each one now. Intravenous route. So here the drug is injected directly into the superficial vein. So like every one of us might have taken the IV injection like this, right? So this is nothing but the IV route. Okay, so this gives 100% bioavailability. So the advantage is this gives 100% bioavailability. So what do you mean by bioavailability of the drug? So that is the fraction of the drug that is available in the body for action. Okay, so 100% of the drug is available, whatever is administered by this route is available in the body for action. Okay, so there is immediate action, so it is used in emergencies. And here drug dosage can be continuously adjusted depending on the response. Okay, and because the intima of the vein, what do you mean by intima? So if you look at the wall of the vein, it has 3 layers. So it has intima, media and adventitia. So the intima of the vein is insensitive. Okay, so that's why it is like highly irritant drugs can be injected by this route. Okay, now coming to the limitations of this route. So as we have studied in other routes also, the limitation would be irritation to that route. So if extravasation of drug occurs, means if the drug reaches outside the vein, there will be thrombophlebitis of injected vein. That what does that mean now? So thrombophlebitis is inflammation of the vein, that is nothing but swelling of the vein with blood clot formation inside. So you can see that here. Okay, so there is swelling and the blood clot inside, and from outside it looks something like this. Okay, and you can also see very beautifully here the swollen and the some like little red darkened vein here. Okay, so this is nothing but thrombophlebitis, and there is necrosis of the adjoining tissue. So what do you mean by necrosis? This is nothing but the death of the adjoining tissue. So there is risk of air embolism. So you might have noticed while giving this IV injection, generally nurse will tap on the injection, right? So that is done to remove any air bubble inside the syringe. Otherwise the air get entrapped into the blood and that lead to air embolism. And this route is very risky because as the vital organs like heart, brain, etc. get exposed to high concentration of the drug. Okay, as the drug is directly into the blood. So this is about intravenous route. Now we are coming to intramuscular route. So here the drug is injected into the large skeletal muscle like deltoid, triceps and gluteus. So deltoid and triceps are the muscles of the forearm. Gluteus will be the muscle of the gluteal region. Okay, so this skeletal muscles, they have characteristics like it has less nerve supply and more vascular. So these two characteristics give it advantages like mild irritant drugs can be injected because it has less nerve supply, right? So less irritation will be there. So mild irritant drugs can be injected and it has faster absorption. Here self-injection is not possible as deep penetration is needed and should be avoided in patient taking anticoagulant treatment. Okay, so make this note here that if this route should be avoided in patient taking anticoagulant treatment. So this is about intramuscular route. Now we are coming to subcutaneous injection. So here drug is deposited into the loose subcutaneous tissue. Now what do you mean by this loose subcutaneous tissue? So if you look at the diagram of the skin, so we have epidermis, we have dermis, and below the dermis we have this yellow colored subcutaneous tissue. So drug is injected into this tissue. Okay, and this tissue is having very rich nerve supply and it is less vascular. Now these two characteristics give it limitations like irritant drugs cannot be injected because very rich nerve supply, so irritant drugs cannot be injected and it is having slow absorption. Okay, advantages of this route will be self injection is possible as deep penetration is not needed. So how self injection is possible? You need to just pull up the skin and inject the drug like this. Okay, you might have noticed diabetic patients taking insulin shots like this, right? So that is nothing but subcutaneous injection of insulin drug. Now limitations of this route would be it should be avoided in shock patients due to vasoconstriction, because as in these patients there is vasoconstriction and already the tissue is less vascular, so there will be more delayed absorption. Okay, so this is about subcutaneous injection. Now we have some special forms of subcutaneous route, that is Dermojet, Pellet Implantation and Sialistic Implant. Now what is Dermojet? Here needle is not used. You can see that in this diagram. If we use the needle, that is normal subcutaneous injection, but here needle is not used and we are using a gun implant. Okay, gun like implant is used and a high velocity jet of drug solution. So you can see that here. So we are giving high velocity jet of drug solution is projected from a microfine orifice into the subcutaneous tissue. Okay. Now, advantages of this special form is it is painless and it is suited for mass inoculation. Now, what do you mean by pellet implantation? So here drug as solid form. So if you notice here we are giving it in solution. Here it is in solid form. Is introduced with trocar and cannula. So what is this trocar and cannula? You can see this diagram here. So this is nothing but the trocar and the cannula. So how the drug is implanted using this instrument. So drug like this solid form of drug is loaded into the instrument and it is deposited or implanted under the skin into the subcutaneous tissue like this. Okay, now next one is Sialistic implant. So here the crystalline drug means the crystal of the drug, crystalline form of the drug is packed in tubes or capsules and implanted under the skin. So you can see the diagram here. So this will be the Sialistic implant and implanted in subcutaneous tissue. So the advantages of this pellet implantation and Sialistic implants are it gives sustained release of drug over the months and weeks. Okay, so we get the drug over the months and the weeks. It is generally used for hormones. So this is about subcutaneous injection. So if you compare these three routes, that is intravenous, intramuscular and subcutaneous route, here drug is injected directly into the vein, into the blood, here into the skeletal muscle, here into the subcutaneous tissue. Here advantages, it is very good 100% bioavailability, immediate action. Okay. Disadvantages, it is very risky because drug is into the blood directly. Okay. Right. Here into the intramuscular route, mild irritant drugs can be injected. Whereas here into the intravenous route, highly irritant drugs can be injected. Here irritant drugs cannot be used. So make the note here. It is highly irritant, mild irritant, cannot be used. Irritant drugs cannot be used. Okay. Here self injection is possible. Here self injection is not possible. Okay. Here self injection is possible. It should be avoided in anticoagulant treatment taking patient. Here it should be avoided in shocked patients. Okay. So this is about intravenous, intramuscular and subcutaneous route. Now come to intradermal route. So drug is injected into the dermis of the skin, raising a bleb. Now what do you mean by the dermis of the skin? So you can see this diagram. So this upper layer is epidermis and the lower layer is dermis. So drug is injected into this dermis. So when you inject it into this dermis, upper layer of the skin is raised. So that is nothing but a bleb. Okay. So drug is injected into the dermis of the skin, raising a bleb. So we use this route for BCG vaccine. Okay, and this is used for specific purposes only. So this is about the parenteral routes. Okay, so this completes chapter 1. If you want any other topic to be added to chapter 1, if you have any questions, you can comment me, and let's meet in the chapter 2, that is pharmacokinetics.